Coming to you live from Philly.
There you go.
Okay. So it's really great to be here. It's amazing how close New York is to Philadelphia without traffic. And a couple blocks away, I was sitting at the red light getting dressed because I drove here in pajamas. Snea's pajamas. And the light turned green, and I was still getting dressed, and I looked up, and the person behind me wasn't hunking me. I was like, I'm not in New York anymore. Yeah, thank you. So when I was in college, I was at a bridal shower of a friend of mine, Aderet. I don't think you were at that one, but you probably know her. Aderet and I know each other a long time. It was a very typical bridal shower for New York. I don't know what they're like in Philly, but it was, Sunday morning, brunch. There was probably a huge bowl of strawberry and mango salad. That's when it first became a thing. And we, at a certain point, sat in a circle to watch the bride open her gifts. And I was sitting in the back row next to, I think, one of the great aunts. And she was lovely. We were chatting the whole time, and she had a great commentary. And about 75% of the gifts were lingerie. And we're sitting there. Another gift is open, and it's lingerie. And this great aunt, let's call her Sylvia, my grandmother Sylvia. Sylvia turns to me and says, do you guys think she's going to be spending more time in the bedroom than in the kitchen? Why didn't any of you get her a peeler? It was a very good question. I love this story because I think it really highlights that sense of not really knowing what marriage and sexuality looks like. This notion that after getting married, sex is just going to happen. It's going to go smoothly. It's going to be exciting. And that feeling close to one another isn't going to take work. And of course, people might tell you that when you're engaged, or every speech at your shavar brachos is like, marriage is work, marriage is work. And the chassid and kala are sitting there smiling. And somewhere inside there might be that idea, yeah, everyone's telling us it's work, but they don't have what we have. Then it's like, come back in 5 years later and they're the ones whispering it takes work. And Suri mentioned Dr. John Gottman. He's like our go-to guy with couple dynamics, because what he did was revolutionary at the time. Now we take it for granted that we always hear about, this is great for couples, this isn't. But when he started monitoring couples and he was looking at what happens in their bodies when they're having conflict, and he was studying their patterns over many years, that was a really big deal at the time. And he's had a lot of interesting observations. One thing that really struck me was he said that he noticed that couples that split up at like the 4-year mark, he saw a lot of high conflict. Couples that he saw splitting up at the 16-year mark, he saw a lot of emotional disengagement. When we're talking about emotional disengagement, we're talking about two people living under the same roof, sharing a family perhaps, sharing a bed, maybe a bedroom, finances, a community. But in terms of actually feeling in sync with each other and feeling connected, the overarching feel to their relationship is that of being roommates. Now, every relationship has a roommate component to it, aka, why don't you leave the toilet seat up all the time, things like that. But when we're talking about roommates, we're talking about this is how they feel in general. He didn't, in the blurb I saw about this, I didn't see anything about their sexual functioning. But I do find that for many couples in a long-term relationship, when we're seeing emotional disengagement, we're typically not seeing a lot of sex. And when I say sex, I'm not just talking about intercourse. I'm talking about sex as a general topic. The word intimacy, I think, is a great word, and I think mishum tznius, from a modesty perspective, I completely understand why we don't necessarily want to throw the word sex around. I'm going to throw that word around because I think that there's a real distinction between sex and between intimacy. We can have sex without intimacy, and we can have intimacy without sex. We can have intimacy with our partners 365 days a year. And sexual intimacy can be one expression of that. The word intimacy actually comes from the Latin word intimus, which means innermost. sex can be intimate in that way, but connecting in other ways can also be intimate. And there's often, as we know, this interplay between emotional closeness and sexual activity. I'm going to talk in a couple minutes about the medical component, because I think that a lot of physiological factors can contribute to a couple's sex life, and that, yes, a couple can be best friends and sex won't necessarily follow very easily. We talk about shell and bias, and the bedroom is part of the bias, and it really affects everything that goes on. I often get asked how important is sex in a relationship, and I feel like it's hard to give percentages on things, but I look at it like this. You have a house, you have plumbing, you have electricity. I look at sexuality as something that provides a sense of electricity in a relationship, a sense of brightness, a sense of vibrancy. It could be an expression of vibrancy. The relationship feels brighter very often when couples are having good sex. You also have a backup generator. Your backup generator is made up of other things besides sexuality. It's made up of things like friendship, commitment, laughter, parenting, maybe common interests, spirituality perhaps. These are the things that keep the lights on in the relationship when sex is not on the table. And sex is not on the table not just for low desire reasons or for needs, but for other reasons too. People travel, people get sick, people grieve. Right? There are a lot of different things that throw off our sex lives. When a couple is having difficulties in their sex life over a long-term basis, they're running on a backup generator for a pretty long time. And buildings are not cut out to run on a backup generator long-term. And that's why when there's difficulty sexually, it affects everything else, because any little thing can feel like it causes a blackout. So just a little minor discussion about something unrelated to sex might feel like, wait, why did this explode into such a big thing? And I find for me in my professional work, when I'm talking to someone and when I'm meeting with a couple, I'm not just looking at the sex piece, but I'm looking at what's in their backup generator. Do they have a backup generator? What's it made up of? And how long have they been running on that backup generator? There's a movie from the late 70s called Annie Hall. Has anyone here seen it? Okay. So I love, in this movie, there's a scene where there's a split screen where Woody Allen is talking to his therapist and Annie's talking to her therapist. And I forgot who gets asked first. I think actually Woody gets asked first. He's complaining about the relationship, and his therapist says, how often you guys having sex? And he says, oh, hardly ever, 3 times a week. And then a second later, Annie's therapist asks her, how often you guys having sex? And she goes, oh, all the time, 3 times a week. I find for many couples, frequency is often a topic that they disagree about, and it becomes very focused on numbers. I like to joke that sometimes I find that the male partner seems to remember with very specific clarity when the last time they had sex was, whereas the woman, she's like, I'm not sure, I think it was a few months ago, and I'm like, oh, whose birthday was an anniversary? Where the man is like, no, 3 weeks ago. But there's so much more to what's going on than just how often is the couple having sex. When we go below that surface to the layers going on under there, we're not just looking at how does the couple connect to each other. We're also looking at what does sex mean for each of you individually. I mean, sex can mean excitement, security, playfulness, bonding. For some, at times, a spiritual transcendence. It also can be. It could also mean disappointment, distance, disappointment, and it means different things at different points in your relationship and at different points across your life. So, just to give an example, if you have a couple where there are a lot of people who have to travel for business. So if you have a couple where one of them travels during the week for business, when they're on the weekends together, that sex is going to mean something different for them than, let's say, for a couple who neither of them are traveling. That's why it's so unique for each couple where sex fits into their context. Now, when we want to improve things in our lives, and especially in relationships and sexuality, we often want tips, right? tell me what to do. You look at most magazine covers in the supermarket, it's usually, you see tips, right? How to get smoky eyes, how to make dinner in 5 minutes, right? Give me tips. Tips are great. Sometimes it's also helpful for us to take a step back and ask ourselves, well, what do I know and what do I feel about this topic? Cognitive behavioral therapy is a type of therapy that looks at that as this triangle of our thoughts, our feelings, our behaviors, and how they all connect. And the Torah knew that a really long time ago, way before CBT got packaged like that. But I think when it comes to sex, it's very relevant because sometimes the focus of a problem is a sexual dynamic with the partner. And we don't necessarily look at, well, what's my own sexual dynamic? What do I know about sex? What's my opinion about sex in general? How do I feel about it? Because we bring that. We bring that not just into the bedroom, we bring that into the relationship. So I'm going to do a quick informal poll. I'm not going to publish these results, and I'm not going to say on here what everyone said, but I'm curious, how many people here learned about sex from a talk with a parent? You don't have to raise your hand, just kind of give me a slight nod. Talk with a parent, okay? Who here learned about sex from a chat with a friend? Anyone here learn about sex from a kid on the bus? Was anyone here that kid on the bus? It's okay, that's probably going to be my kid, but it will be accurate information. So I find that, and I don't have time today to talk about how to talk to your kids about sex, but consider this my plug, that it's not a question of if your kid hears about sex, but when. And if they hear about it from a parent, you have the power to put it into a context of certain values and boundaries and gut and giving them that space, because they're going to hear about it. But most of us who were coming of age either before the internet was around or when it was first starting out. So I find that for many adults, at best, what they learned about sex, at best, they heard about it from a parent, at best, as this is what a mommy and a daddy do when they want to have a baby and they love each other. That's usually at best, right? There's usually no discussion about pleasure. There's usually no discussion about orgasm, which I understand. We're not necessarily going to tell 10, 12 year, whatever it is, And there's usually a list of don'ts, right? Don't have sex before marriage, or don't have sex with this person, or high school sex ed often comes with a lot of warnings also. Don't get pregnant, don't take a drink from a strange man, whatever it might be. A lot of don'ts. And then where's the education supposed to happen about what normal sex looks like? So we have these messages that we see in movies or books, and we don't have a competing script for it. So we're so vulnerable and susceptible to absorbing those ideas. And then we have kala classes for some women. Before they get married, they might learn with someone. And yeah, that's really, I think there's something really powerful about sitting with a religious member of the community and hearing what the Torah has to say about sex. But for a lot of people, it's theoretical. And it's very different to learn about something when it's theoretical. And this is even if a couple was sexually active before they got married. Married sex is a totally different situation. So what I see are scores of people, Jewish, non-Jewish, who are just completely uneducated about some basic stuff about anatomy, about sexual response, about what normal sex looks like. And I find that there's so many times where when you're looking at an escalated situation around sex, you start peeling it down and there's this real misinformation under there. So I'll give an example. There's this thing out there that it's normal to have pain for the whole first year of marriage. I don't know what pamphlet's being passed around about that. Yes, in the very beginning, the first few times someone has intercourse, it might be uncomfortable, but on this monthly for the entire year. So what I find sometimes happens is that I'll meet couples, or I'll meet a woman who's been having painful intercourse for years, and hasn't found the right help for it, and her husband feels really horrible. Every time they have intercourse, he feels like he's hurting her. So there's a part of him that wants to connect with her in that way, but another part of him that feels really bad about it. And he starts to have erection issues because it's a very nerve-wracking experience. By the time they get help, they are so set in a certain pattern, and that original issue has now given birth to all these other issues, all these side effects of that original problem, when if early on there had just been more information about it, it could have been avoided. And again, it's very hard to get accurate information. There's a lot of shame. You know, if I have a problem with my phone, I know to get help for it because A, I know what to expect from my phone when it is working, and I know I can go to the store and ask the guy for help, or woman, to help my phone. And I'm probably not ashamed to ask other people, oh, do you know a good phone store, right? Most people don't walk around and be like, oh, I have to go because I have to go get my phone fixed, right? It's not usually a source of shame for people. Relationship and sexual issues typically have a lot of shame involved. So when we're talking about what is normal sex, right? So when we see it in the movies, or portrayed in books, or even just in people's kind of notions, their fantasies, so the man and the woman, their desires are totally, is this still working? Yeah. Their desires are totally on par. They both want sex at the same time. She gets revved up as quickly as he does. His penis slips right in, doesn't come out or go into the wrong hole. She doesn't have to guide him. There's no lubricant. He's thrusting. There's no baby crying. There's no one passes gas. Nobody falls asleep in the middle. They have orgasms at exactly the same time, with her having an orgasm from intercourse alone. There's no cleanup afterwards.
I think it did stop.
It did stop. Okay.
Just try talking into it again.
Okay. Can you hear me now?
Yeah.
Okay. And then afterwards, they're just lying there, chatting, no one's sleeping, and you don't hear the woman say, oh, let me go pee so I don't get a UTI. Yeah. I've never seen that in a movie yet. Yeah. And if you did, that would be considered a comedy, right? If a baby, if the kid walked in the middle, that would be considered a comedy, right? You wouldn't see that in passionate sex, right? So the expectations piece and the education piece plays a huge role. So it's always good to look at yourself and say, well, like, where did I learn about sex, and what did I learn about sex? How do I know that what I know is necessarily accurate, or I don't know, is there more to it? So these are some of the common myths I see that come up. So this idea that men are the sexual gender and that women just want romance, and I think it's a huge disservice to both genders, because what ends up happening is that men feel uncomfortable expressing themselves emotionally. So you can have a guy hit a really hard day at work, and instead of being able to come home and sit and say, you know, I'm really scared. I might lose my job. I feel really insecure at work. It might come out more as just initiating sex. And again, I'm giving what is just, not everyone is different, but men versus women. Men, because of our cultural messages, tend to speak more from their penis than from their heart. Whereas women, I find, are a lot more comfortable speaking emotionally from a place of an emotional place as opposed to from a sexual place. I mean, if you look at little kids, little girls are just as sexual as little boys, right? But somewhere along the way, girls get a message of, you take your hands out of your pants and you never put them back in there, right? As opposed to, God, oh, boys will be boys. He just always has his hands in his pants, right? So even that, the messages that start early on. The idea of desire, right? That if I'm not having desire, then it must be for psychological reasons. So if you were at the movies and there was a couple sitting in front of you, a teenage couple, they're all over each other, you probably wouldn't be sitting there saying, they must have really good communication, right? Or, he probably bought her flowers tonight. You would be thinking to yourself, oh, raging hormones. So we're able to recognize the role of hormones for teenagers, but yet for adults we get all psychological, when the truth is hormones play a tremendous role. So someone asked before about the birth control pill. The birth control pill is a wonderful invention. What it does is essentially is it manipulates the hormones of the body to prevent pregnancy. Part of that is it lowers estrogen levels, which can translate into vaginal dryness, right? The vaginal tissue stays healthy when there's estrogen there. What it does is also is it raises a protein in the blood that's called SHBG, which stands for sex hormone binding globulin. And SHBG binds to testosterone and makes it unavailable. So what ends up happening is that your free testosterone that's floating through your body now becomes unavailable, which then can translate into having a lower desire. Testosterone also is important for the vaginal tissue, and that's why very often women, when they're postmenopause, will sometimes use an ET cream, an estrogen testosterone cream, to help rehabilitate their vaginal tissue, which may get drier postmenopause. So birth control pills can definitely really have an effect on desire, and I can't spend too much time on this now, but it is a longer discussion in terms of the options out there for firm women when it comes to birth control, because it's complicated for a lot of people, and I also find that it's a very specific thing where many Rabbanim are not going to publicly say you could do this for birth control versus that, but if you talk to them one-on-one about a situation, I see a lot of situations where the Rabbanim are extremely flexible. And people do respond to different types of birth control pills, so there is variation in the hormone levels of the pills. That's why, and it was said before, to really try to talk to your doctor if you are having side effects. I find because sex is an awkward topic, people don't like to bring it up. Same thing with psychiatrists. A lot of medications have an effect on sexual desire, sexual functioning. A lot of SSRIs, Zoloft, Prozac, these can really affect orgasm as well. And yes, mental health definitely is up there, but a lot of people don't like to bring up to their prescribers that they're having sexual side effects, so the prescriber can't necessarily work with you on tweaking medications, adding in other medications that can offset. So for example, Wellbutrin, which the generic of that is bupropion, is not an SSRI, but it's an antidepressant that does not have negative side effects sexually for most people, and often psychiatrists will prescribe that for someone who, if it's appropriate given their diagnosis, they'll prescribe that to try to offset some of the negative sexual side effects that they might be having from some of the other medications that they're on. So again, obviously mental health is important. I'm not saying anyone should go home here and just say, okay, that's it, I'm going off my medication, but rather to engage in a discussion with whoever your provider is if you feel or wonder if it might be affecting sexual functioning. There are other things that can also affect desire in terms of our pituitary gland, stress. Suri mentioned the idea of physiologically what's happening to us when we're under stress. When we're under stress, so we're basically taking a bath in cortisol, and that is there for survival purposes. If I'm in the forest and a lion jumps out in front of me, at that moment in time, my body is like, you need to get out of here, right? This is not the time to get pregnant. You do not want to have sex right now. You need to be on the run, right? So if we're stressed out, super stressed out, our body is like, yo, testosterone people, quiet down. We gotta get away from this tiger, right? So the ability for stress management, to do stress management is so important. I just saw a study actually that was saying that when basically what I was just saying, that when we have increased cortisol levels, even if you have a high testosterone level, it prevents the body from experiencing that effect. Arousal. So something I see that comes up for people is this idea that if I'm not lubricated, if I'm not feeling lubricated down there, then it must be I'm not turned on by my partner. And yes, lubrication in the vaginal area can be one sign of being turned on, but the reality is that we have lubrication all over our bodies, in our eyes, our skin. Some people are just more lubricated than others. Some people have drier eyes than others. Some people have drier vaginas than others. In terms of lubricants, so very often people go to KY. KY can be very irritating. When you want to look at a lubricant, you want to go for something that's more glycerin-free, so it's less irritating. Coconut oil is actually a wonderful lubricant. They sell it in the supermarket. And it's natural, it's not goopy, and it doesn't stain sheets. And I find it to be, for a lot of my patients, I think coconut oil is great. Right now, coconut oil in general is kind of like the cool thing. It's like, Windex in my big fat Greek wedding. Just use it for, I know people use it for acne. It's like, take a bath in it. But as a lubricant, it's actually a really great lubricant. And I'm telling you, I've seen people who for years, they've been using KY or they're using a lubricant and it irritates them and they don't know why and they can't figure it out. And sometimes even just shifting that can make a huge difference. This idea that desire always comes before arousal, that's also a common thing for a lot of women. I think the arousal piece, so one of the things that I think is complicated about it is that if we're walking around all day kind of shut down arousal-wise, so this idea that we're just going to then go home at night and go 0 to 60 is not so realistic for a lot of people. I kind of look at it and I see this across the board, not just in the religious community, it's like we have a certain pop-up blocker that we get when we're growing up that basically kind of keep those pop-ups down. The things that turn us on, the people we might see who we find attractive, right? And it serves us because a lot of people are uncomfortable acknowledging what or who might turn them on. And then you get married and there's this expectation that, okay, I'm going to keep my pop-up blocker on, but I'm still only going to see pop-ups that have to do with my husband. I'm only going to experience anything erotic about my husband. And the reality is that when that pop-up blocker is on, I find for many women it's very difficult to just then switch gears. And it's scary for people to think about what might turn them on. Esther Perel is a big therapist. She has a great TED Talk, actually. It's like 18 minutes long. She talks about long-term sex and long-term relationships. She says, many of the things that arouse us at night are causes we would protest against during the day. I thought it was very true. What you're trying to say is that arousal doesn't exist in the confines of who we are and present to the world, which is, I think, why it's so uncomfortable for a lot of people. I mentioned before this idea that you should orgasm at the same time. I find that to be a huge source of stress for couples. To have that expectation that both couples need to orgasm at exactly the same time through intercourse is extremely stressful. I mean, at exact same time, you're not synchronized swimmers, right? You're different, your bodies are different, your preferences are different, and it causes a tremendous amount of stress. Tremendous. Where do we get that idea from? Again, a lot of these things, when we peel them down, there was some notion that we picked up somewhere that sex is supposed to look like this and it's supposed to be a certain way. I find for many women, having an orgasm with their partner is more vulnerable than having intercourse. I see a lot of women who they can, let's say, have an orgasm by themselves, but having an orgasm with a partner is a lot more difficult. So part of that is just, I think, from a mechanical perspective and also trying to give directions and explain what to do. But I also think part of it is the vulnerability piece. I think it's difficult to have an orgasm with a partner when vulnerability is something extremely scary to avoid, which it is. Vulnerability is scary, and we live in a culture where we can avoid it on a pretty regular basis. But when it comes to sexual functioning and it comes to orgasms, vulnerability is a big piece of that. As I said, most women do not have an orgasm from intercourse alone. So most women have an orgasm, and again, there are some who do, but most don't. So there are women that have an orgasm from manual stimulation of the clitoris, or oral stimulation, or a combination. There are women that have an orgasm during intercourse while there's simultaneous stimulation of the clitoris. Vibrators can definitely help. I think we have a certain association with vibrators as this, kind of kinky shop in Times Square that you keep walking. But they're actually very high end. They sell them at Sharper Image and Brookstone. You can feel free to come over to me after if you want recommendations for different types. I used to bring them actually to talks and pass them around, but everyone got a little like kind of middle school-esque and like kind of passing a frog. Like, so I was like, okay, we'll just mention it. But vibrators are very common, especially for women as they get older, right? Their bodies change, orgasms can become more difficult. And this idea that it's not natural if there's a vibrator in bed, I sometimes hear that. And again, there's that notion somewhere that sex is just like this natural thing. You can't have anything else that's helping it or enhancing it. We accessorize everything else in our lives. What's wrong with accessorizing a sexual relationship with your spouse in bed, right? So again, it often goes back to these notions that we carry about what sex is supposed to be like and look like. I mentioned about having pain during intercourse. So I want to mention a condition called vaginismus. Has anyone here heard of vaginismus? Okay. So vaginismus is a condition where you have involuntary muscular contractions of the vaginal wall, and it makes intercourse either extremely painful or impossible, or just any type of penetration. Very often women who have vaginismus struggle putting up a tampon, even getting a finger up. It's the kind of condition where there's a lot of shame around it. It's one of the top reasons for unconsummated marriages. I see couples who have been together for years and years, and I see this Jewish, non-Jewish, across cultures, where intercourse can't happen because of vaginismus. And I'm happy to hear that more and more people are hearing about it. I think the internet is helping because people are looking up their symptoms and hearing that there's a name for what it is that they're having. But one thing I will say about it is that it's so treatable. I mean, I'm thinking right now about a case of a woman I saw who is, I work in a medical practice that specializes in sexual dysfunction, just to kind of throw it out there. I'm a therapist, so I'm not looking at anyone's vaginas, if I want to keep my license. And she'd been married 25 years and had 2 kids by her husband ejaculating at the edge. Good swimmers. But she had never had intercourse. She had never had intercourse. Not Jewish. She did not grow up Catholic or anything. This was not something you could be like, oh, she heard sex is bad. She was very small frame, very tight muscles, and once it became a problem, she became more anxious. When we're anxious, we tighten our muscles even more. We were able to treat her in 10 weeks. 10 weeks later, she was able to have intercourse. This woman was 54. She had intercourse with her husband for the first time. And it was, for me, such an emotional case. I might cry about it right now. It was so emotional because, on the one hand, she was like this giddy teenager. And she was like, I was just lying there, and it was so powerful. We were able to share this. But it was also so sad because there was so much grief over those years that were lost unnecessarily, right? If only along the way. And she had told doctors, I feel like I'm on Oprah, but she had told doctors about it, right? She had told them, but people didn't know how to treat her, and they were just like, have a glass of wine, relax, go on vacation, which those things are great, but they weren't curing their problem. This idea of what good enough sex is. We live in a culture that's very anti-aging. There's billion-dollar industry. Every time I go to the pharmacy and I see something, it's like, oh, get rid of your under-eye wrinkles. And I'm like, And we have this idea that as you get older, you become less sexual. That seniors having sex is so gross, right? And it happens to be that in nursing homes today, STDs are a huge problem. No, I'm serious. Because they're not getting sex ed, right? And these women, they went through menopause already, so in their minds, the only thing to worry about was pregnancy. So that's also something that I find, and I'm throwing that out now because I think somewhere in our minds, if we think that getting older means becoming less sexual, we start to turn off those parts of ourselves that are sexual, because we think that this is just what's supposed to happen. This idea that you have to have a certain kind of body in order to have good sex, that, only tanned, very thin, right, which our culture promotes a lot, which, in terms of sexual functioning does not have to mean that. This idea that sex has to be spontaneous. I find a lot of people struggle with that it has to be spontaneous, it can't be planned out, because what does that mean if we're planning out our sex? And it's so interesting because you have so many other things in your life that you plan out in advance. But when it comes to sex, why do we have this idea that it has to be spontaneous? And you know what? If you're having spontaneous sex and that's happening and it's working for you, wonderful. But if you're not having the spontaneous sex you want to be having, but you don't believe in planning out sex, the situation is going to stay exactly the way it is and probably get worse. So the idea, I'm going to take questions at the end.
Just a quick
Yeah.
comment. I don't know if anyone here has watched the show Parenthood.
Yeah.
There's an episode where they talk about that. One of the brother sees his brother's phone, and at the 10 o'clock slot, it says Funky Town.
Funky
And,
Town.
makes fun of
I
his
like
brother
that.
The whole episode for planning out sex, but then it turns out his wife wants him to do the same thing.
Oh, nice.
And to share whatever. It's cute.
Yeah. Someone just shared a comment putting in a plug for scheduling sex. No, because whenever I listen to recordings and I hear that someone commented, I'm like, what did they say? Yeah, right. This idea of planning it out, right? Especially for people who are super organized and need things to be a certain way and can't have sex if there's a dish in the sink, right? Like spontaneous sex is probably not going to happen in those relationships, and it often becomes a big source of tension. Sometimes I'll hear people say, well, I don't want to plan it out. My partner's really going to be offended if I have this idea of scheduling sex. And every relationship is different, so it depends on their unique situation. But I find that when you have a couple where there's rare that you have a couple where they have equal levels of desire, very often the higher level desire partner, even if they say, oh, I ideally would like to have sex 3 times a week, for many people, their fear is not, oh, I'm not going to have sex 3 times a week. It's, I'm not going to have sex at all this week. So for many couples, if they have this idea that we have a scheduled time, it can alleviate some of the tension. Again, every couple is different. It works for some, not others. There's other, I think, kind of fine print to it that I think could be relevant. But again, I'm saying this because, again, it taps into that notion we have that sex is just supposed to happen and be spontaneous. This idea also that your partner's supposed to be able to read your mind about what feels good for you is something that I think we know intellectually, but emotionally, somewhere inside might expect that if I need to communicate to my partner what feels good for me, then that's a really kind of b'diavad situation where I really shouldn't have to explain it to them. And over the years also, different things feel good for people. These things shift around. I see this all the time. What people might have liked when they were younger, as they get older, may not be something they're into. So it's not just this one time, okay, we need to talk about what feels good for us, but even as on an ongoing basis. And the idea of there's a time and place to talk about sex with a partner. Suri mentioned this in terms of framing it. While you're lying in bed undressed is not a good time to talk about the fact that the way they touched you didn't feel good. Because I find that when people are undressed, it's the epitome of vulnerability. So when we're going to have a conversation like that, we want to make sure that we're in a setting where the other person can receive that information in a way where it's not going to injure them even more. I'm going to talk a few. How am I doing with time?
It's 11:40.
11:40. Okay. Going to try to speed this up. I'm going to talk about menopause for a little bit. People don't talk about menopause. It's something people kind of dread. They don't really know that much about. From what people know, they hear menopause as just being you stop getting your period. But the thing is, number one, whereas when you're, let's say 12, 13, or however old you were when you got your period, you knew, okay, I'm getting my period. For many women with menopause, there's a lot of fake out, breakout. They thought it ended, and then 6 months later, they got their period again. And it's kind of this back and forth. And the same way when you get your period, getting your period fits into going through puberty. So going through menopause fits into kind of like a middle-aged puberty of other things, other hormonal changes that are happening. Perimenopause happens 8 to 10 years before menopause. For Jewish women, I'm seeing this is becoming more relevant, is that more women are now electing to have hysterectomies because they tested positive for the breast cancer gene. So when a woman goes and gets a hysterectomy, she will, if she gets her ovaries out too, she will often go into menopause. I actually, a few years ago, did a phone lecture with a group of women who all had hysterectomies, and I think the oldest person was 45. And it was really interesting because a lot of them actually said, they said sexually, I feel at a loss because I was taught that Taharas Mishpacha was going to kind of regulate my sex life. And now I don't get my period, and I'm kind of like, what do I do now? But anyway, putting that aside, so when menopause happens in a more dramatic fashion after hysterectomy, the menopause is going to be a lot quicker, whereas perimenopause is more stretched out. When a woman goes through menopause, either from, let's say, cancer treatment or from getting hysterectomy, it could be more dramatic. At 40, we have half the testosterone we have at 20. Our estrogen levels decrease. Orgasms become more difficult. The birth experience can be traumatic in terms of what it not just does to us emotionally, but the effects on our bodies, right? Some people feel really ashamed of stretch marks, or even down there, you know, in their vaginal area, they might have had stitches. Here's a plug for pelvic floor physical therapy. Does anyone here know any pelvic floor therapists in the area? Or yeah, talk to them. Pelvic floor therapists do really great work. Really, really great work. What?
The Bloom ambassadors just learned about it this past week.
Yeah. Yeah. Pelvic floor therapy is a subspecialty of physical therapy. They do great work down there, and they help not just with, you know, the tight muscles and pain, but also incontinence, and, you know, there's so many great stuff that they're doing. I mentioned about people are scared to get old, and yes, our hormones change and things shift. But what's interesting in a lot of studies of women about how they feel as they get older, they actually feel better about themselves. A lot of women, they'll say, you know what, I don't have the body right now that I had at 20, but I actually feel more confident. And the first time I read this, the first thing I thought about was the Loehmann's dressing room. And if you've been there, you know exactly what I'm talking about. Remember my mom taking me as a teenager. It's like this huge room with like 2 little dressing rooms, and all the women over 40 are like trying on bathing suits, right? And then there's the 2 dressing rooms with like all of us teenagers waiting online with our moms being like, what's the big deal? You know, it's the 90s, so it's probably like, I don't know, trying on like what, sweater sets and ball gown skirts or something. But now I get it. Those women trying on bathing suits, they were like, I don't care, right? So as much as we might be nervous or not like so excited about getting older and what is this going to do, for a lot of women, actually their confidence levels get better, and a lot of them are having better sex as they get older because they feel like they can say more about what they want. They feel more confident. They feel more aware of even just what works for them. Okay, so I want to talk for the last few minutes about the awareness of the self that we bring into relationships. And this is not about our dynamic with the partner, because like I said, everyone often, the focus goes to what's going on with the partner. Let's look at ourselves and kind of what's our belief system. What did we grow up hearing about sex? What did we hear about marriage? Did we hear like jokes around like, oh yeah, you get married and there it goes, right? Like, do we hear that stuff? What did we see in our parents and our grandparents? I thought of a funny story, but I'm not going to tell it now. What is your relationship like with your body? Not just when you look in the mirror or how you feel when you look at the size. What is your self-talk about your body? And this is not about sex. This is about in general. How in touch am I with my body, right? Because if I don't live in my body, and not just inhabit, but if I don't live in my body, how do I expect to experience pleasure there? It's like saying I'm going to host a housewarming party in a house I don't live in, right? And I see this come up for women all the time. And there's actually a benefit to us being checked out of our bodies, because I'm sure some of you have had this. You get woken up by one kid at 4 a.m. and then the other kid needs you, and it's 7 a.m. and you just realize, I've been up for 3 hours and I've had to go to the bathroom this entire time, right? Or you're busy doing a million things on a Friday and all of a sudden you realize, I forgot to eat lunch, right? So sometimes there's a benefit to that ability to be disconnected from what's going on. But when it comes to sexual pleasure and being able to really feel it, I find that that disconnect cuts off that ability to feel that. And for women who are not nourishing themselves properly with food, and they're restricting, and they're not giving their bodies what it needs, it's very difficult in those cases to experience sexual pleasure. Not just because their body's yelling, get me a sandwich, but also because they're putting their bodies into starvation mode, or they're putting their bodies into this place where it's like, I'm not running at full capacity here. How can I experience pleasure when I'm just trying to keep the basic functions going? The energy piece is huge. Social media, I find today, is a huge obstacle for many people when it comes to sex, because this is what ends up happening, is that people come home at the end of the day, and even if they're having a nice interaction with their partner where the first word is not, did you pay the bill? Even if they have a nice conversation, very often the way we unwind is by, is that my time? Very often the way we unwind is actually by turning away from each other, right? So what ends up happening is like, you eat dinner, maybe take care of bedtime, whatever, and then when you're unwinding, so you spend, let's say you spend an hour on Facebook looking around, you were only planning to go on for a few minutes, you're now on someone's page, you're like, I don't even know this person, I don't know how I got here. You just spent an hour of this energy going outwards. And the images that we're seeing, even though we know intellectually that there's a lot more to the picture, and that our friend who's posting the picture from that cruise, we know that there's a lot more going on in her life, and that life's not always perfect. When it's 9 o'clock at night and you're seeing those images, emotionally, you're not taking in that truth. So what I find, and this is where social media is becoming more complicated for couples, is that you're turning outwards, kind of taking in all this stuff on social media. And so then by the time the couple climbs into bed together, which rarely are people even getting into bed at the same time, there's not just that sense of fatigue, but there's that disconnect, right? So even though they're back in the house together, the minds are now spinning about this other stuff of, you know, oh, that couple, they look so happy, and, you know, she just posted basically a Father's Day message to him, to the whole world, you know, like, and again, I'm not saying that people shouldn't appreciate each other. I'm not saying that, but I do think that social media has taken it to this whole other level. We've always seen images of celebrities, of, you know, where we could easily look at them and think they have a perfect life, but the danger of social media is now we can easily see that photoshopped version of our own friends' lives. And from a sexual perspective, and from an energy perspective, a vibrancy perspective of a couple being able to connect to each other and feeling content being together, it's a killer. Even eye contact. When we have eye contact with one another, we have these mirror neurons that have a party. And now with social media, we live behind screens, right? Just think about it. The other day I was talking to someone, we were having a serious discussion about something going on in the community, and she then chuckled. And I'm thinking, why you let? No, she was looking down and saw someone sent her a funny text message. So for couples, even just what role does the phone have even at home? What role does just that kind of exiting? Because there is an exit that happens with that. I want to leave time for questions. So if you want to hear the funny story about my great aunt, you could come over to me afterwards. What? You want to hear the story about my aunt? So my,
Because otherwise you'll just have all of us coming after.
Okay, my great aunt was on a cruise. They're married 65 years. I'm from a family where people are very open about sex, not in an inappropriate way, but I think in a nice way. And they were on this cruise. It was a stand-up comedian, and he starts picking on these newlyweds sitting in the front row, because that's what they do. And then he said, okay, who here is married 10 years? Okay, a few people raised their hands. Anyone married 20? Anyone married? Anyone here married over 50 years? And my great aunt, who was in a wheelchair at the time, because she broke her hip. I know, so stereotypical. So she's sitting in the back, and they say, oh, wow, we see a hand in the back. How long have you been married? And she says, 65 years. And he goes, so what's your secret? She goes, I never had a headache. And it's a funny story, and it's funny hearing them tell it. But, and I think it's difficult, because I think that often issues around sex kind of get simplified in that way, of like, you know, people telling themselves, okay, tonight I'm going to do it. I'm going to psych myself into it. Like, I'm just going to do it. And then things just kind of get in the way. So I think even just looking at your own nightly routine, because often people say, we just don't have time. We don't have time. We're really, really busy. Okay, so look at the time you are spending together. Look at what your night looks like. Look at what your weekends look like, right? Is Shabbos being over-programmed, where it's all about the Shabbos meals and hosting this, and I gotta make cranberry crunch, right? Like all that stuff, all that noise. Shabbos can be an extremely powerful time for a couple to connect. We're unplugged. We don't need to run out to work. We can have conversations with eye contact, right? But I think we tire ourselves because we're focused on this one. People please, we're having this. We have to make like 5 side dishes, right? And for a lot of couples, there's something that gets lost in that because the details become more about everyone else as opposed to how can we make Shabbos more of a time that we connect. I want to just wrap up with this. There was an article in the New York Times called Why You Will Marry the Wrong Person. It's a very depressing title, but it's actually a really great article. And I think they just made it a catchy title. But there was a paragraph at the end that went like this. Romanticism has been unhelpful to us. It is a harsh philosophy. It has made a lot of what we go through in marriage seem exceptional and appalling. We end up lonely and convinced that our union with its imperfections is not normal. We should learn to accommodate ourselves to wrongness. Asterisk, certain situations, the wrongness is bad, like abuse and whatever. Just want to throw out the caveat. We should learn to accommodate ourselves to wrongness, striving always to adopt a more forgiving, humorous, and kindly perspective on its multiple examples in ourselves and in our partners. I see this come up for people not just in the confusion they have about whether what they're going through is normal, but in people's hesitation to go get help. Because they feel like we must be the only people that are having this problem. Everyone else seems to kind of, there's this dance that everyone else seems to know except for us. When the truth is, every couple has to work on navigating this. Every couple is constantly trying to adapt to the new changes going on in their relationship. I kind of look at it as like, they say like eagles, they fly in this upward spiral, right? I think that for many couples, you feel like you're going in circles, but I think that the opportunities for growth there can lead people upwards. There are definitely setbacks, there's no question about it. But I think this feeling of, am I the only one who's going through this? Most questions I hear are framed as that. Rachel, did you ever hear this question before? And odds are I've heard it many, many times. So that's how I probably wrap up, is that sex is something that we bring a lot of ourselves into. It's normal to not be sure if what we're going through is normal. Our bodies are constantly changing, and so our relationships are changing, our sex lives are changing, and that if we have a gentle attitude towards our body and we could start tapping into not just what we need to take care of, but what do I feel in this moment? How do I feel right now? Am I fighting what I'm feeling? Am I yelling at myself? Right? And hopefully we should all have Amir Hashem, Mashiach. You thought I was going to say something else. And it's really great to be here.